Testing is a part of the strategy. So we want to increase testing, and we also want to be able to isolate as many people as possible, catching infections early to mitigate transmission and reduce networks of transmission. But part of that conversation has to be a real in-depth discussion about the factors that are predisposing certain groups to having higher rates. When we look at household transmission, we know that that's a significant factor. When we look at the types of jobs who have been asked to perform work and go to work in the last several months as essential employees, that percentage of workers who are frontline responders correlates very strongly to the number of cases that we have and who is disproportionately impacted. So we need to make sure that in our questions to our efforts to increase testing, we also are having those real substantial conversations that are going to address the root causes that are predisposing certain groups to having more cases. And those are the types of substantial conversations that are going to create the systemic change and the systemic improvements that are not only going to take away the factors that are predisposing folks for having COVID, it's also going to take away the facts that predispose individuals to having adverse outcomes, health outcomes across the board, particularly when we talk about health disparities.